I would also like to invite the chairpersons for this session, Dr. Deepa Kapoor, Dr. Shikha Gupta ma'am, and Dr. Ruchi Kalra for the next sessions. Yukti Wadhwan ma'am, she will deliver her lecture on melasma and menopause, and the chairpersons will be the same. Yukti Wadhwan.
Yes, this one. Yeah. Thank you. A very good afternoon. So in the epidermis and sebaceous glands, the collagen, elastin. So I think the previous speakers have covered all of this, so I'll directly come to what we all want to hear. So what is melasma and what does it look like? So basically, it is a skin condition with light brown, grayish blue patches. So if you've noticed, so many women have patches here on this area, at times the jaw. So whenever you look at them, ऐसा लगेगा जैसे छाया सी है, परछाई सी है, right? It is so common, we see that. It will usually appear as flat, or it is not like, the boils or erythema. It is flat, freckle-like patches that you see. Commonly affected areas are the face, including cheeks, the malar region, nasolabial folds, the jawline, and anywhere on the neck. So what causes? Genetics? Yes, definitely. So if you see about 33 to 50% of people with melasma have a positive family history. So they either have it, in their mothers or their sisters also, the similar condition. If you have twins and one of them has melasma, so definitely in the identical twin, the other one would also have melasma. Hormonal drivers? Yes, hormones are regulating our entire lifetime, So in perimenopause and menopause, hormonal changes, fluctuations do trigger melasma. Sun and heat sensitivity. Definitely, sun is a big trigger. And whenever you go out without the sunscreen, without layering, without creating a skin barrier, the UV light is affecting your skin, causing photoaging, phototoxicity, and hence hyperpigmentation. A lot of drugs are sensitive to sunlight. So, if somebody is taking retinoids or certain antibiotics, NSAIDs, the skin becomes sensitive to sun and hence the phototoxic reaction occurs. Certain scented soaps or certain kind of skincare, moisturizers also have an impact. So prolonged, if you're using a particular kind of a soap or a moisturizer and it's causing pigmentation or darkening or a patchy skin, you need to look into it. Tanning beds also, people who use tanning beds on the beaches, so at times even those have a higher reason for melasma. Fairer skinned people are less likely to be affected by melasma than those with a wheatish complexion. Women are more likely to have it than men. Pregnancy is a trigger, and also patients on hormonal pills trigger melasma. So it can be either epidermal, that is a superficial one, wherein you see a dark brown color patch. If it is a deeper dermal, you will actually see a lighter grayish kind of patch on the skin and not a darker one. And there can be mixed. So the most easiest to treat and temporary is epidermal because it is superficial. So whatever you apply on the skin, it will work. But the dermal and the mixed one really is a task to treat. Other causes, hypothyroidism, LED screens, our mobiles, tablets. So all the blue light that is coming from the laptop. So people who have a continuous use of that also. I'll tell you, so when I get these girls who come for their pre-bridals, so there is a trend in Delhi that they come to us for the technical treatments and no longer is the era for facials and the beauty parlors there. So I particularly tell them, when you go for your lehenga shopping or your bridal trousseau shopping, please use a sunscreen even in the evenings because you have those very bright lights to show jewelry and the trousseau outfits. So even those lights are going to have an impact on your skin. So whatsoever you're doing in the morning and evening mein shopping ja rahe ho, so everything goes khatam. So signs, see, most common, we have talked, it's the face, but there is extrafacial melasma also in postmenopausal women, which is brachial, centrofacial, lateral cheek pattern, malar, mandibular, and anywhere on the neck. Now coming to the management and treatment part. First thing, daily sun protection. Second is topical treatments. Third is the procedural, the EBDs. And the fourth is creating a good skin barrier home care. The first thing to do is use a good sunscreen so that you don't worsen the melasma condition. And also avoid LED screens, minimize it, irritating soaps, scented, anything that is scented and you apply it on your face is going to have an irritable reaction to the skin. It is as clear. So always no scent, no color is the best thing to use on the face. If people have been on prolonged OCPs, also they should discontinue because that might be leading to the hyperpigmentation. Sun protection, especially you have to instruct people that from 10 a.m. to 4 p.m. the sun is at the peak. So you have to apply a sunscreen which is at least 30 SPF. You can go up till 50, 80 is also available these days in the market. And ideally, the sunscreen has to be repeated every 4 hours if you're out in the sun. So topical skincare, we have a big list, azelaic acid, retinoids, niacinamide, vitamin C, hydroquinone, kojic acid. You must have found all the serums that are available, online and been marketed very well. So usually it's a combination of either of these. So I'll just talk about the main ones that is important. And the one main ingredient is tranexamic acid that is not mentioned in the list, and it is missing in most of the serums and all which is available online. Tranexamic acid, we all know, is a plasmin inhibitor. Antifibrinolytic effect is there. It is anti-inflammatory, anti-melanogenic, and anti-angiogenic. So this drug works by stopping the breakdown of blood clots, thereby reducing or stopping excessive bleeding. So not all pigmentation is aging. It might be the red or the brown thing might be because of the little blood clots that accumulate and give a dark or a pigmented look. Tranexamic acid can be given orally, topically, intradermally by microinjections mesotherapy, or transepidermally by microneedling. We know the mechanism of action. So oral also we know you can start the patient and give her, maybe 500 to 1500 mg divided doses for a period of 6 months. You can give a topical ointment. Usually tranexamic acid comes with hydroquinone and you can apply, but hydroquinone has to be applied with caution. I'll tell you in the further slides. Microinjections. So if you do a micro needling or a microderm abrasion kind of a procedure, or you can have very minimal intraepidermal injections done on the hyperpigmented, the melasma area, so that also gives a wonderful result. Hydroquinone is a very good skin lightening agent. It works by inhibiting the enzyme tyrosinase to reduce melanin production. It is very effective against severe hyperpigmentation. It can also lead to skin irritation. Now there is something known as rebound hyperpigmentation that occurs with hydroquinone. So if you've noticed at times, I think we all have seen these people around us, but we don't recognize, especially on the forehead area. If you've seen, you just feel somebody's skin is looking very rough or very thinned out or very cracky or very dark. It is a typical case wherein the patient has used a skin lightening agent with hydroquinone for a longer period of time. So whenever we prescribe hydroquinone, we tell the patient it is to be used for a limited period, not a longer time, because it will further have rebound hyperpigmentation, very thinned out, cracky skin, and then you are gone. Because then no devices, no procedures will work there. Arbutin is also very effective, very good for perimenopausal, menopausal age group. Retinoids, we all know, and retinoids have an advantage on the fine lines, the wrinkles, and the sagging also, so it will give a firmness to the face as well. Kojic acid, very, very friendly, can be used in all age groups. Niacinamide, one of the best things to be used. Most of the vitamin C serums and the creams available have niacinamide. It also is very effective for acne-prone skin with melasma because it would not have an adverse, flare-up for the acne as well. Vitamin C, glutathione, I think all of us know plenty about it. So just another word of practice. Whenever you prescribe oral glutathione, please prescribe with vitamin C. It will increase the potency, it will give a better result. If you're going in for IV drips, you can actually combine both of these. I've been using IV drips for my patients, for myself, for past almost 9 years now, and it works very well. Coming to the second line therapy, so it is not always that, as gynecologists, when we start our aesthetic practice, we have to buy a machine. No, you can actually start your practice with gaining confidence in prescribing little things, in making little changes. So the first thing that I started with was a peel. Chemical peels are very effective, very easy to use, and very friendly, less investment in terms of, starting the practice. So peels usually with glycolic acid, lactic acid, mantelic acid work very well. They give a good, cleaner, brighter appearance if the patient has an acne-prone skin. So probably you can use a salicylic along, and that will have a good effect on the acne also. Cosmelan peel is a very good depigmentation. It is a professional kit that we do. So wherein we have a chemical peel which has a certain instructions that has to be done on the face or the intimate area, and then there is a strict home care along with it. So it is a two-step treatment that works in the patients. Now coming to lasers. So as we have talked about so many lasers, for vaginal tightening and all, so why it all started primarily by the dermatologist for face, for contouring, tightening, lifting, reducing fine lines, and reducing pigmentation. So types of laser, we know ablative, non-ablative, and the most effective for deeper pigmentation is Q-switched Nd:YAG lasers. This is different from the Nd:YAG laser we've talked about since morning. So this treatment is wherein you use a high intensity beam released in short pulses, targeting specific areas on the skin with a wavelength of 1064 nanometers. These laser beams emitted during the treatment penetrate deeper into the skin and target the areas with an excessive brown color pigment called melanin. These pigments absorb the beam, which causes them to disintegrate in the cells. The body then flushes out the destroyed pigment. So basically, पूरा pigment यहाँ इकट्ठा हुआ था. We've given the laser impulses. We break it down. जैसे fat breakdown होता है. So similarly, the pigment is broken down into multiple clots, and then the body flushes out. It detoxes. Microneedling also is something very easy. You can start in your clinical practice. So simple, it has fine needles to create tiny punctures in the skin which stimulate collagen production and help with acne scars and pigmentation. I'm just finishing, give me 1 minute more. Right? Along with microneedling, you can actually put tranexamic acid if it is a dark brownish. If you feel that it's not just hyperpigmentation, you can use tranexamic acid. Also, you can give micro injections of vitamin C. That works very well. Hydrofacial, very common, very popular these days. Definitely no chemical usage, nothing, safe, and works very well for instant brightening. Morpheus, and now this is one thing that I use. We've spoken about the InMode. So I have a platform which has face and body as well. So Morpheus 8, it just doesn't work on melasma. It evens the skin tone, sunspots, acne scars, fine lines, and also the dullness of the skin it works on. The mechanism of action, basically it's an RF, it's a radio frequency energy that is given. So higher energy can be applied safely to the tissue here. It will not cause any burn because we have a temperature control which we do by ourselves. So we don't increase the temperature to that level wherein it will cause any scarring or any burns. Larger volume of the tissue can be treated, and once again, so with the micro needles that you put, that you apply to the skin. So if you see the first picture, those fine gold tip needles are there. So when that is applied to the skin, it will break down the pigment, the melanin, so into smaller pieces. And finally, with time, it will flush it out. So how does it work? It has a triple action. It causes ablation, fat coagulation, and volumetric bulk heating. So all the three layers of the skin, if you see there, So the epidermis, dermis and subcute. So all the 3 layers are taken care of. That is why the collagen stimulation also happens, and there is a tightening and the lifting also of the skin that works. So this is how it works. If you see the needle when it enters, so the red zone is the ablation, the orange is the coagulation, and there is a non-specific heating. So the needles are placed very, closely, so that you actually have an entire tissue depth that is taken care of. So pre-treatment, just a topical numbing cream is required. We need multiple sessions for it, at least 4 to 6, depending on the age of the patient, the condition, and what is required. Post-treatment, just a minimal redness, swelling is there. So if I'm combining this with a PRP or exosomes, so then I actually would want to contradict to a previous speaker. I would strictly not use any NSAIDs, any ice packs there. When you are doing a procedure, you are creating an inflammatory reaction. You want that to happen for the skin to repair itself, to heal. Especially when you're putting in PRP, don't give any NSAIDs. You want the inflammatory reaction. Just counsel the patient. It's going to last for maybe 2 to 4 hours, and it's going to be fine the next morning. Also, do not apply ice packs until and unless she's very paranoid with the redness that's caused. It's all your counseling. Don't apply. You want that reaction so that the healing occurs. Otherwise, you're nullifying the effect actually. So these are my patients which I've done with Morpheus for melasma. And you can see a drastic change in all of them. So I have a lot of pictures in my phone. I can probably show you how it's done. Important considerations. Melasma often worsens during pregnancy or any kind of hormonal fluctuation as in perimenopause and menopause. Treatment expectations should be very realistic for chronic and recurrent melasma. Avoid treatments that may worsen, like certain laser things which you can't do it on the darker skin. So you have to be very selective as to which procedure to be done on which skin type. And consider seasonal timing of the treatment also is very important. Not all seasons suit to all kind of things that you apply on the skin. So you have to have a complete knowledge and hang of before prescribing this. Thank you.